for this epidemic. We're targeting the cartels in Mexico, and we're targeting the Chinese suppliers of the chemicals. But DOJ is also putting resources into raising awareness. We're supporting public health and safety programs across the country, programs that are aimed also at prevention, treatment, and recovery. All of these efforts and resources reflect the Justice Department's commitment to addressing and preventing substance abuse and overdose deaths in our communities. Here in Utah, our agents and our prosecutors are also working every day to get fentanyl out of our communities and to bring to justice those who are responsible for bringing it here. We are particularly focused on people like Mr. Shepard, people who cause death and injury through their deceptive practices of distributing these pills. In many of the overdose cases, the victims do not know that they are purchasing pills that contain a lethal amount of fentanyl. Right now in this office, we have 9 pending cases involving individuals who distributed fentanyl, causing the death of another person. That's 9 families who lost a loved one because of this practice, because of the distribution of this poison in our community. Here today we have Serena Whistler, an assistant United States attorney who's also the deputy chief of our organized crime section and our overdose death coordinator. You're going to hear from Serena a little later. Serena was the lead prosecutor in the Shepard case. She's also the lead prosecutor and assisting with all of the overdose cases that we have in the office. We were lucky to be able to hire Serena here when she already had a lot of experience in this area that she brought with us from another U.S. Attorney's office in St. Louis. Serena brought her expertise and her experience, and when she came here, immediately started building and training officers throughout the state. We're building task forces, we're training officers and agents and prosecutors throughout the state so we can improve our ability to investigate and prosecute these cases. We're also going to hear today from DEA Assistant Special Agent in Charge, Dustin Gillespie. DEA leads the fight across the country of addressing this epidemic, and we are very fortunate here in Utah to have ASAC Gillespie leading our fight. Through his leadership and his talents, he has been able to bring resources and put together the teams and the tools and the resources we need to address the problem so we can better protect our citizens in Utah. We also have with us today, as you heard from Ms. Martinez, we have some agencies that were helpful and responsible for investigating the Shepard case. Of course, the Drug Enforcement Administration was a big part of that investigation. Also, the United States Postal Service, represented by Mr. Bill Zemblage, and we have a couple of postal agents in the audience here today. Postal Service is a big part, as you can imagine, in going after the distribution of fentanyl, as the mail system is frequently used to distribute the product and the chemicals. We also have Park City Police Chief Wade Carpenter here. Where's Wade? Oh, I just looked right. Wade Carpenter here. Thank you for being here. Chief Carpenter and his department, of course, investigated the underlying case where Mr. Shepard was involved with the death of 2 juveniles in Park City and then was involved extensively in the investigation in this particular case of Mr. Shepard. So later, if you have questions about the Shepard case, Ms. Whistler will be able to address those, and we also have the agencies here. I also want to talk about, just briefly, to announce our Utah Drug, I've got to read the title here, our Utah Drug Overdose Task Force. We have created a Utah Drug Overdose Task Force. The work of this task force is really important to bring together agencies from throughout the state so that we have people throughout the state looking at and working on this particular issue. So I want to introduce some of the people here that are helping on this epidemic and helping with the task force. We have, of course, DEA. We have HSI. HSI represented here. Salt Lake County Sheriff's Office, Sheriff Rivera has been very involved in helping us get the tools and resources we need to work on these issues. We also have Salt Lake County Police Chief Mike Brown, who's easy to find because he's tall. Chief Brown, of course, has been involved in this issue for a long time and jumped in to help us with the task force. Layton City was actually one of the departments that originally proposed this task force, and we've got Chief Alan Swanson here with us today representing Layton City. Ogden City, we've got Captain Timothy Scott here to represent because our chief is out of town. And then Davis County Sheriff's Office, Chief Deputy Taylor West is here. Thank you for coming from my hometown, Davis County. And Chief Carr from South Jordan Police Department. These folks, along with some other agencies, have been very important to putting together the task force and making sure that we can investigate and bring to justice as many people as possible who are responsible for causing these deaths in the state of Utah. Thank you.
Good morning. My name is Dustin Gillespie. I'm an assistant special agent in charge with the DEA. I oversee DEA's operations here in Utah. Thank you, USA Higgins, for hosting this press conference and bringing us all together today. First, I'd like to say how proud I am of the DEA task force officers and agents who worked tirelessly on the Shepard investigation. In particular, I'd like to recognize the Park City Police Department and the U.S. Postal Inspection Service, for it was their case agents who led the investigation from start to finish. Yesterday's sentencing was the culmination of a lot of hard work and a lot of collaboration between law enforcement agencies from all over the Wasatch Front. The notion of collaboration brings me to the topic I'd like to talk about this morning, which is to announce the formation of the Utah Drug Overdose Task Force as a collective law enforcement response to the rising number of drug overdoses and poisonings in our communities. This task force is the first of its kind in Utah, but follows a similar trend in drug enforcement policing from other areas of the country, including the Rocky Mountain region. The task force consists of investigators from several law enforcement agencies across the Salt Lake Valley. Those agencies are represented by the many chiefs and sheriffs standing here with us. We have all seen firsthand the destruction that drugs have inflicted on our citizens and communities. Drug distribution knows no city, county, or geographical boundaries. Fentanyl and other deadly drugs are indiscriminate. They are in all our neighborhoods, and they are in our schools. Our children are particularly vulnerable. I implore you to talk to them about the dangers of fentanyl and other drugs. All of us standing before you felt the overwhelming and compelling need to do more to address drug overdoses and poisonings, and to seek justice for those victims and their families. The Utah Drug Overdose Task Force is the result of our collective vision. The task force will serve three primary purposes. First, we will identify, investigate, and prosecute those criminals who distribute drugs resulting in the death or serious bodily harm of another person. Second, the task force will consolidate intelligence, particularly digital evidence, from overdose crime scenes in order to identify potential linkages between different incidents. Lastly, the task force will seek to train and educate first responders from around the state on how to properly process and preserve evidence at a drug overdose and poisoning crime scene. This last aspect alone will greatly improve law enforcement's ability to identify distributors and develop investigations suitable for prosecution. Thank you all again for being here and help us raise public awareness to the dangers of fentanyl.
Good morning. My name is Serena Whistler. I am currently the Deputy Chief of the Organized Crime Section here in the United States Attorney's Office for the District of Utah. I'm also proud to serve as the district's representative to the Overdose Task Force, about which ASAC Gillespie and U.S. Attorney Higgins just spoke. This is an issue about which I am extremely passionate. I've worked in this area on behalf of the Department of Justice for nearly 10 years. I have seen the ravages of opioids and watched countless families grieve the loss of a parent, a child, or a sibling. This problem is pervasive and affects people of all races, ethnicities, and socioeconomic backgrounds. There is simply no typical overdose victim. Through the creation of the task force, we hope to accomplish several goals, perhaps the most important of which is to increase awareness of this incredibly important issue. The best way to prevent drug intoxication deaths is to warn the public as loudly and as clearly as we possibly can of the dangers of these drugs. It is no exaggeration to say that one pill can kill. In fact, the word overdose is to some degree misleading. Even therapeutic amounts of these drugs can lead to death or serious injury under the right circumstances. It is crucial for the public to understand that dangerous opioids, including fentanyl, lurk everywhere. Every day, DEA and their state and local partners behind me seize other drugs adulterated with fentanyl. Counterfeit pharmaceuticals continue to be an enormous problem, as ASAC Gillespie alluded to. Just yesterday, United States District Judge Howard Nielsen sentenced 23-year-old Colin Shepard to 20 years in federal prison after he sold counterfeit pharmaceuticals through the internet to another young man in Park City, Utah. The recipient of those pills nearly died after ingesting them. As you may recall, in 2016, two 13-year-old Park City students died after ingesting a synthetic opioid they had purchased at school. Colin Shepard was the source of those opioids. Because he was a juvenile, he was not incarcerated for his conduct. Instead, he moved to Nevada, where he began acquiring counterfeit oxycodone from the Netherlands and elsewhere. Mr. Shepard marketed these drugs over encrypted apps and assured his customers that they were legitimate oxycodone that he had obtained from Canada. He also went so far as to claim that he tested each batch of pills in order to ensure that they did not contain fentanyl. These were lies. Mr. Shepard knowingly exposed his customers to the possibility of death or serious bodily injury. This office is proud to have held Mr. Shepard accountable for his callous and criminal behavior. I have no doubt that the arrest and prosecution saved lives. The Overdose Task Force will continue this important work. We will do everything in our power to raise awareness, to participate in prevention efforts, and to enforce the law against drug dealers like Colin Shepard, who inflict misery on the state of Utah. Thank you very much.
So we have time to take just a couple questions if anyone has any questions.
So can you explain a little bit how the new task force is different than DEA, what they're already doing? Are you simply going, DEA is trying to prevent drugs from coming in and you're after the fact and they've overdone already?
I'm going to let ASAC Gillespie answer that one.
Well, I'll start off by saying that DEA is a very small agency, and the strength of the DEA comes through our partnerships and collaborations with our state and local and other federal agencies. And so that's the collaborative aspect of this task force, is that it consists of detectives, officers from a myriad of different law enforcement agencies here, starting in the Valley. We're going to grow it, but we're going to start small, get our processes right, and then we're going to start to expand. But what that means is that those detectives and officers are going to hold collateral duties. They're going to stay with their departments. It's not going to be an additional resource suck from our local law enforcement agencies. They're going to be designated, carry this duty as a collateral duty, and respond when we need them. And we are there to guide and assist agencies like Sandy Police Department. They don't have a representative here, but they are part of the task force. And if there's an incident in Sandy City, for example, this task force is there. We are 24 hours available to respond to that scene and guide that first responder through the process of evidence collection so that we can make sure that we have our best foot forward to make a prosecutable case. So it's really, it's a group of folks that will work together as a team 24/7. And then the DEA task force, our DEA office here in Salt Lake City is here to help screen and review those investigations and cases and present them to the United States Attorney's Office.
Basically, you're going
That's right, and I want to make that clarification that there are many folks who are misusing illicit substances. For those folks, those end users, we want you to get the help that you need to overcome that substance use disorder, get out of the throes of addiction. You are not the target of law enforcement, not the DEA. We want those distributors, those individuals who are profit-minded, who are looking to expand their client base by increasing addiction in our schools and in our communities. Those distributors are the ones, those are the targets of our drug overdose task force, the ones who are distributing those pills that are causing harm to others.
Will everybody get 20 years if they get caught, or what's the current statute?
For that particular statute, I can let AUSA Whistler talk specifically about that, but there is a minimum mandatory sentence of 20 years to life imprisonment.
So what's your message to people if you're a distributor watching this? What's your message?
The message would be that we are coming after you. The DEA and this task force in particular, we are watching, we will investigate, and we will seek to bring justice to those distributors who are causing harm in our communities.
You want to talk about the importance of naloxone, not only in this case, but also in general?
Sure. So, and that probably is a good segue to kind of introduce what we have here on the table. So, we have between probably 50 and 60,000 fentanyl pills. So they are counterfeit pills, fake pills. They are not legitimate oxycodone pills. They are fake, and they contain fentanyl. While I'm at it, I'll say that 2 milligrams. It's 2 milligrams of fentanyl that is a potential lethal dose. That's just enough to fit on the tip of a pencil. More than that, almost instant death. 2 milligrams is enough to shut down an average person's respiratory system and cause death. 50 to 60,000 pills. I think we were looking at a couple of different cases of that the DEA and the task force has worked on. They come in all different colors. Here on display we have green and blue. Also we have the naloxone kits. The Narcan or naloxone have those. Law enforcement officers are required to carry them nowadays, at least the DEA task force officers and agents. They are used to reverse the effects of opioids, including fentanyl. Absolutely a must carry for our officers out on the street and for all of the overdose task force investigators as they respond to crime scenes as well. They will have naloxone kits with them.
Does this go back to the notion as part of the problem that these pills is a clean drug, you're not using syringes or smoking something, if it's a pill that's more attractive to everyday common people?
I would agree with you. When I give talks about some of the drug trends that we see here in the state of Utah, one of the concerns that I have, and I think you just alluded to it very accurately, which is we're seeing fentanyl begin to supplant heroin. Black tar heroin is very, very common here, particularly in the city. And that hurdle to get into fentanyl misuse is no longer there. Pills look innocuous. They look safe, especially to kids, especially when they come in a whole bunch of different colors, especially when they're tableted to look like a Bart Simpson head or a Flintstone vitamin, like a Tic Tac. They look very safe. Gone are the days of hiding needle injections, having tinfoil and spoons and lighters, and that barrier to entry is gone. It's eliminated with the introduction of pills, and the cartels know that. That's why they're doing it, because it's so easy to get into and drive addiction.
Serena, will you talk about the sentencing structure for causing death through distribution?
The statute that we typically use in prosecuting individuals who distribute opioids or any drug, any controlled substance that results in death or serious bodily injury requires a mandatory minimum term of imprisonment of not less than 20 years and up to life. There are ways under certain circumstances that we can achieve results where a person might serve less than 20 years, but as a general proposition, the statute requires a sentence of 20 years. In the particular case of Mr. Shepard, given his history, the nature and circumstances of the offense, the extent to which he concealed his, the true nature of the product that he was selling, this office believed, and Judge Nielsen ultimately agreed, that a 20-year sentence was entirely appropriate.
So, and you said something earlier, did Shepard, you said, did not serve any time in juvenile detention for his prior crimes?
He did not.
And so when you got this case and you learned this history, what was your thought?
In the 10 years that I've been prosecuting cases like this, I think Mr. Shepard is probably one of the most dangerous individuals that I have ever encountered. He is incredibly bright. He learned how to navigate the dark web to acquire illicit drugs at the age of 15. And even after the deaths of two 13-year-old classmates in 2016, he continued to do that knowing full well what the potential consequences were. And I have not seen in my career someone with such an incredibly callous disregard for the lives of other people.
Thank you. Thank you all for coming. We appreciate you being here today to discuss this important subject. Thank you.